Hey guys, it's Dr. DRMTLGY, board certified dermatologist here in the Seattle area. I do medical, surgical, and cosmetic dermatology. And I love connecting with all of you across the world talking about skincare and dermatology education. And today's video is very important because I'm going to talk about the 3 most common skincare mistakes that I see in my practice. I compiled very common mistakes that I see, and I'm always talking about this on a daily basis. I see 30 patients a day. I do skin cancer surgeries, but a lot of it's just me talking to my patients and giving education as well as diagnosing and treating skin cancers. So big things that we're seeing are people coming out with beet red, irritated faces, contact dermatitis. We'll be talking about why you're getting irritated in the face, the most common reasons, and also hyperpigmentation. This is a big mistake people are doing if you have hyperpigmentation or melasma. So let's jump into it. Number 1, retinol. We love retinol, but you're using too much retinol and you're not moisturizing with your retinol. When I see patients coming in saying, I don't care for my tretinoin, I don't care for that retinol I purchased, I always ask, how are you using it? How much are you using it? And are you moisturizing? Because I think the moisturizing part is the non-negotiable part. You always need to moisturize when you use a retinoid, say a prescription retinoid like tretinoin, triferritine, adapalene 0.3%. Tazarotene is another retinoid that I prescribe. And I have to say that if you don't moisturize after applying your retinoid, that you're gonna run into some trouble. So I know there are times when I feel like I don't wanna moisturize, but I always think about my patients coming in with that red, peely skin and they're really swollen or they're getting that peeling around the mouth. I always think about them, then I go looking in my drawer for that moisturizer because it's totally worth it. You need to moisturize. So how to use a retinoid appropriately. It's a pea-sized amount, and if you're starting off, I usually say do it about twice a week, and then slowly increase it every other night to nightly. I don't care for skin cycling because you need to use your retinoid consistently at least every other night for it to work at its max effect. There are different retinoids. The one I talk about a lot on the channel is SkinBetter Science's Intensive AlphaRet or just the regular OG AlphaRet. This is nice because it's a retinoid. Alpha hydroxy acid is like lactic acid and it has glycolic acid. If you go with the Intensive AlphaRet, that's more glycolic acid than their AlphaRet. That just has a smaller percentage of glycolic acid. Now all you need though, every time you use it, whether it's twice a week or every other night to nightly, is a pea-sized amount of any retinoid, whether it's prescription or something you buy at your store or online. So it's usually a pump is what gives you a pea-sized amount. So that's a pea right there. Came out a little not so attractive there, but you break it up into 2 parts and you put dots in your face. Okay? And then you connect the dots. And that's how you spread it evenly. You can put a little bit less around the mouth because that's where it's really irritating, but retinoids help with fine lines and wrinkles, and as we get older we definitely get those fine lines and wrinkles around the mouth, so you don't want to completely ignore it, but this is a very sensitive area. You could bring it down to your neck, but maybe just start off with a half pea-sized amount for your neck, but don't neglect your neck and your chest, back of your hands, so you can use your retinoid in other places. For your face though, it's a pretty large pea-sized amount. People always say online, I don't believe you, I feel like that's not enough. This is enough retinoid for your face, okay? And then you follow up with a moisturizer. Moisturizers I would consider would be the Roche-Posay Double Repair Matte Moisturizer if you have very oily skin and you wanna have a lightweight gel moisturizer. It's kind of like a nice consistency like Neutrogena's Hydro Boost. That's another nice option. See here? Couple swipes and it disappears. That's a great gel moisturizer if you have oily skin to combination skin. If you have very sensitive skin, dry skin, I like Vanicream's daily moisturizing cream here. Also comes out lightweight. Works well with your vitamin C serums in the morning or your retinoid in the evening. So you would apply that over your retinoid. If you're starting off and you're running into trouble with your retinoid and you're getting really dry, definitely back off on the frequency and then consider the retinoid sandwich where you're gonna apply a layer of moisturizer first, then your pea-sized amount of retinoid, and then follow up with another layer of moisturizer. So you sandwich that in to increase tolerability. Another good moisturizer too is a Toleriane Double Repair Face Moisturizer by Roche-Posay. This one is the non-UV. This one isn't the one with the SPF 30. I'll show you the texture of this one. Another nice lightweight one that works well with retinoids. So those are great moisturizers to consider. If you have active irritation on your face, especially around my cheekbones in the wintertime, Cicaplast Balm B5 by Roche-Posay, very nice. Maticasticides helps with healing, soothing, and it has panthenol and shea butter, so very good rescue balm. That's not like a greasy ointment, but more of a soothing balm, creamy texture. That's fine for the face, but this is very versatile. It's one of the most versatile skincare products out there. So the first mistake is that people are using too much retinoid and not moisturizing after. So that's actually just all one mistake there, okay? I want you guys to stay consistent with your retinoid. Mistake number 2, if you have hyperpigmentation or melasma and you have a lot of dark spots in the face and you're doing all the right things like using your retinoid, using your vitamin C serum, using sunscreen, what are you doing wrong? A lot of people are using just regular non-tinted sunscreen. So you wanna go for SPF 30 and above, and you wanna block UVA and UVB. My big question is always when patients come in with stubborn melasma or hyperpigmentation is, are you using a tinted sunscreen? Now there are different tinted sunscreens. I've done videos on melasma, on tinted sunscreens. There's a few out there that are really good that I like to use on a daily basis, including Dermatology's Universal Tinted Moisturizer, the CeraVe Hydrating Mineral Sheer Tint SPF 30. I like Tizo. They make great tinted sunscreens. And then recently Neutrogena has done a good job. I feel like they're ahead of the game. They say they're late to the game, but I think they're ahead of the game by having multiple shades of tint. Now, tint-wise, it's almost trial and error to see what works for your skin type. Thankfully for me, my skin type works for a lot of different tinted sunscreens, but darker, deeper skin tones, those patients have a harder time finding tinted sunscreens that work well, that doesn't make their face look gray, orange. Having iron oxides in your sunscreen, you can have some funky colors that appear on your skin. So it's definitely trial and error, and I love that Neutrogena has various shades. They have a light shade, they have a medium. This works well for my skin tone, which is like Fitzpatrick skin type 3. And so the medium works very well. I'll show you right now. I had this on for clinic today. And then they have 2 other shades darker than this. And those are for skin tones darker than mine. Now, why do I rave about tinted sunscreens is that it has iron oxides. So if you look at the ingredient list, you see iron oxides in the inactive ingredient list. That's what you're looking for, because we found that iron oxides are important in blocking visible light from the sun. Just 10 minutes in the sun and you're wearing regular sunscreen blocking UVA and UVB without the tint, you can actually worsen your hyperpigmentation. So it's very important to have tinted sunscreen every day. And I wear it every day before going to the office, because me being Asian, I get a lot of hyperpigmentation, and growing up in Hawaii, that's another concern. I'm getting more of these sunspots showing up. So I think the tinted sunscreen is huge for my patients who are particularly skin of color. And that is mistake number 2, is that you're missing out on your iron oxides in your sunscreen. Number 3 would be overdoing your exfoliants. I saw a few patients today who have broken blood vessels or broken capillaries, telangiectasias in the face, because they're using harsh exfoliants either with the beads like St. Ives. They have these shells in the beads that can be traumatizing the skin, or they're using harsh exfoliating brushes, pore vacuums to try and clean out their pores. And that can lead to permanent red spots on the face. And the only way to get rid of it would be to cauterize it with my electric needle or a V-beam or pulse side laser. So they are very stubborn to treat. You can use a cream to get rid of those red spots. And also I'm seeing people coming with really bad irritant contact dermatitis from exfoliating way too often with chemical exfoliants. So say with your alpha hydroxy acids, your lactic acid, your glycolic acids, you get the Ordinary's glycolic acid and you're using an exfoliant every day. That's a problem, right? You're not supposed to be exfoliating every day. I always say 1 to 3 times a week max for exfoliating. So when someone comes in for a beet red face, my questions would be, are you using a niacinamide serum? No, because niacinamide, especially at 10% or higher concentration, can cause irritant contact dermatitis very commonly in my patients, especially for my teenage patients who don't need a niacinamide serum, right? The other question is, how often are you exfoliating? And if they say every day, I'm not that surprised, because a lot of you are exfoliating very frequently. We're not meant to be exfoliating with bristles, scrub brushes, and then also these chemical exfoliants. We're not supposed to be breaking off and exfoliating dead skin off of our delicate faces that often. So stop if you have an irritated face, use your Cicaplast Balm B5, and then just stick to 1 to 3 times a week of a chemical leave-on exfoliant. That's different from a cleanser with benzoyl peroxide or salicylic acid or a alpha hydroxy acid cleanser. Very different from that. That's a cleanser. You don't leave it on. You can do that on a daily basis, especially after working out. You want to clean out your pores. But if you want to leave on say Paula's Choice beta hydroxy acid every day, I don't advise that, right? We're gonna be really damaging our skin barrier and getting into trouble. So those are my top 3 mistakes I've been seeing recently. I'll keep doing these videos every once in a while, but just wanna thank you guys for your engagement. I love that we're approaching 600,000 subscribers and friends here on the channel. Thank you guys for watching. Thank you for sharing with your friends. Please hit the like button, please subscribe to the channel and hit that bell notification. We'll have a new video every Saturday morning at 9 a.m. Pacific Standard Time. I'll see you guys for the next video. Enjoy this nice weather, and I'm gonna have a sunscreen video coming out later because we definitely gotta talk about sunscreen. All right, take care and peace.